I have access to so many other healthcare professionals and mentors who kind of help me review more complex cases and kind of double check my work for me, or I can bounce ideas off of if something's not working well. And I think this is really important. I think if anyone claims they have the answers to everything and that they are like a godlike figure, that is a massive red flag because we are always continuing to learn. Actually, we have to legally for continuing education purposes. And I find a lot of value bouncing ideas off of other colleagues sometimes because, again, sometimes we just get stuck in our own boxes and it's really helpful to have that extra opinion. So some clinical pearls that I've learned along the way, I know I mentioned some of them already. One thing is if you take a couple, like a tablespoon or two, mix it with some water of apple cider vinegar, keep listening. This is not voodoo. And you consume it right before you're about to eat a meal. If you find nothing happens, then your stomach acid's probably in decent shape. If you find that it really like helps you digest that meal better, you have less of your typical GI symptoms when you do this, it probably means we could use some stomach acid support. And this is something you can keep doing to help with that if you want, while we address the root cause of why it's low in the first place. Um, if you get a lot of like pain or like worsening of symptoms, this typically indicates that there probably is lower stomach acid, but there also may be some like H. pylori or ulcer, like erosion type of stuff happening where it's really irritating your stomach lining. And you don't want to keep doing this, obviously, until you address the root cause of why that's happening. So, Clinical Pearl DIY home test, that's pretty cheap to do. Another thing you can do is to basically understand if you tend to eat those high protein meals. I think I already said this, but if you tend to eat those higher protein meals and they just sit like a rock and they don't digest well, we probably want to address stomach acid support because protein is first digested in the stomach by stomach acid. So that's something we can probably address. If you feel like you have a lot of food intolerances or a lot of carbohydrate rich foods like grains, gluten, those types of things, just cause a lot of bloating, don't sit well, you feel like you need to cut them out to have no symptoms, that's a red flag for like small intestinal bacterial overgrowth. You may have some dysbiosis going on, and we probably want to address like stomach acid and maybe understand what our bacteria situation is like through stool testing. If you tend to have a lot of like fat intolerance, so when you have like higher fat meals, and I'm not talking about like a bunch of French fries or like a fried seafood or chicken tender meal with a bunch of French fries, which would be a lot of fat for like anyone to digest. Or if you're like, just for fun, had like two whole avocados and then got a stomach ache, that's not what I'm talking about. But if when you have like avocado toast, or if when you have peanut butter, or if when you have a burger, or if when you have like, a little bit of olive oil on your veggies and you're like, I feel like this is a normal amount, but I have a lot of stomach issues. Like I have diarrhea or I get a lot of bloating. I just don't tolerate it that well. I'm burping a lot. Clinical Pearl is to check gallbladder support. And that doesn't mean scary, have to have your gallbladder out. If you do have your gallbladder out, it means we need to be extra supporting of bile flow and managing our fat dosing in our diet so that your body can handle it better. Because the gallbladder essentially is for dosing bile to help you digest fat. So if we take that away, it's just like a slow drip from your liver. And if you have a high fat meal, it's still just going to be a slow drip, and it's probably not going to be enough to help you digest it. So we can do some gallbladder and bile support, which I help clients with all the time. And if you're taking supplements for things like vitamin D deficiency, low ferritin, B12, that's low, those types of things, and you're taking the supplements or you're addressing, the diet rich, iron rich foods in your diet, that type of thing, and your blood work's not really changing, we want to check the gut because it's not getting absorbed properly. So those are some clinical pearls that I hope are helpful starts if you're just kind of looking for a place to start. Now I want to kind of transition. This is a long one. It's fine. Now I want to transition into the colon cancer study and some of my takeaways from this. So the original study, which is titled Risk of Precancerous Advanced Adenomas of the Colon in Long Distance Runners, is linked in the show notes. It's pretty short. It hasn't been put through peer review yet. It's kind of still coming out essentially, but some of the information was published in this 2025 in the spring. So I'm assuming we'll learn more about it as it comes out. And it also sounds like there is more research being done by the same researchers based off their findings, which is pretty cool. The study took a look at 100 different runners who participated. 55 were female and 45 were male. So pretty good breakdown of female versus male representation, which we love to see. The runners were aged 35 through 50 years old. And they completed at least 2 ultras or 5 marathons. So they had to, kind of be more than just recreational runners and take running distance a bit more seriously in order to participate. This is one of the first studies to really only focus on like a higher endurance volume type of athlete. I'm curious to kind of learn what their training volume was like, because you could have someone who's done 5 marathons on like 20 to 30 miles per week. And you could also have someone who's done 5 marathons on 120 miles per week, right? And those are like different things. They're the same, but different. So I am curious to learn more about that. It was a prospective study, so it's just kind of observational. And there was a intervention to screen for certain things. People were excluded if there was known history of irritable bowel disease, if they had a family history of basically adenomas, if they had Lynch syndrome. And they were given a survey before the colonoscopy intervention to basically go over their diet habits, their running history, and their bowel habits. I'm super interested to kind of see the survey results that I wasn't able to find for this, because that would also just be interesting to see, like, what were their diet habits like? Are they underfueled? Are they fueled adequately? Are they running 20 miles a week on average? Are they running, 60 miles a week on average? Do they have some bowel issues? Do they have symptoms, or is nothing happening? I think that would be really important to know and see. And essentially, they did all this and then did a colonoscopy and found that what was expected from like the 40 to 49-year-old category from just general population, which is old data. This is a little bit I don't know how accurate this is for 2025, but was about 1.2% of people in this age range were expected to have adenomas, precancerous colon tumors in the colon. 1.2% were expected. For this population, so for the runners in this study, 15% had at least one adenoma present on their colonoscopy. That's a big, that makes me pause. That's a pretty big difference when we're talking about population specific. And the reason that the original doctor wanted to do this study is because he was noticing that there were more and more like ultra endurance athletes, like I think he had 2 or 3, coming in with end stage colon cancer and passing away than he thought was reasonable, essentially, who were, perfectly healthy, quote unquote, people. And he was like, I wonder if there's a correlation here that anyone's ever looked into. So, that's a really big difference. 1.2% is expected, and then 15% is what's found. And the kind of focus on younger people too is because of colonoscopy screening best practice in the US. So, colonoscopy kind of frequency best practice. Typically, you start screening if you have an average or a low risk of colon cancer at age 45. So the issue with like young people is that we're developing these adenomas before we're really put into the regular colon cancer screening process. So should there be earlier interventions for endurance athletes is kind of what he's asking with this study. So I want to preface this by saying everything I'm about to say and everything he's found so far in this study are theories. This is a correlation. This is not causation. This is one study on this population that has shown this. We also have other studies on high level athletes and people who exercise a lot of hours per week that show the opposite. They show no effect, no increased risk of colon cancer. They show improvement in terms of risk of colon cancer if you exercise. So we want to put this in context with the body of research always, and not just like change everything we're doing because of one study. Everything I'm about to say and that he was talking about too in the findings are theory based. And this is why we want more research on this, because yeah, that's a big difference, right? 1.2% to 15%. And we're talking about like really late stage colon cancer, at least one adenoma, things like that. So theories as to why, from both his perspective and also mine, is like an excessive, like extreme amounts of exercise like we do as runners, especially running specifically, where it's a high impact, high intensity activity, even if you're doing it at a quote unquote easy effort. This causes a lot of blood to be shunted away from the GI tract. It can cause quote unquote exercise induced gastrointestinal injury, according to his research. That's that ischemia that I was talking about earlier in the episode, which is why I gave all that context before talking about this study. So this is a real thing, that blood being shunted away from the gut so it can't do its own TLC on itself and take care of itself properly. If there's underfueling too, and we know this is also a big problem in endurance athletes, and we're not getting the materials we need to give the gut the TLC that it needs, yeah, I could see how maybe an adenoma could develop, right? That's a theory. It's not fact, but it's a theory. Is that lack of blood flow? Is that lack of nutrient rich blood, whether it's because the blood flow is not great or there's not enough nutrients coming in through the diet, part of this picture? And could fueling adequately, proper off season, proper recovery tactics lessen the risk of this happening? That's a theory. Another thing to consider, besides half of all endurance athletes underfuel, is, maybe eating disorder history. Again, why do they underfuel? Is it lack of information and education? Is it because there's prevalence of weight and appearance really being focused on for the wrong reasons that can trigger eating disorders? Like, why is this happening? I'm always thinking about the why. So that's something to consider. Another thing is alcohol consumption. I have that on my list because we know from other studies that a lot of races and running groups meet at breweries. They have beer as kind of like the race sponsor or the reward. I finished the Chicago Marathon in 2019 and they handed me, I think, a Goose Island beer before I even got water. So we know that culturally, alcohol intake can actually be associated with endurance sports. And is alcohol consumption also going to increase risk of cancer? Yes. So that's something to consider, whether you're a runner or not. One thing that I think is going to be brought up, that I've already seen brought up on like Reddit threads. Yes, I'm in the Reddit threads sometimes reading them. Try not to be often because I'm a bit scared of Reddit. But as a response to the study, people have been talking about already, which makes sense. Is it because of all the sugary stuff that runners are consuming? We know from research that increased amounts of different sugars can be associated with an increased risk of colon cancer. I think this is very nuanced, because what I want to ask is, what if we're not consuming adequate carbohydrates during our runs? That's going to cause health issues too. So we really got to weigh the pros and the cons and find a middle ground here, I think, is my answer to that. And I think if we're consuming a ton of sugar all the time because we never take an off season, we're always in marathon training, we're always trying to keep up with really high carb needs, we don't have a lot of balance in the diet because we're not allowing our body to recover properly and therefore give us more flexibility to have less of these foods. We're not having a lot of fiber because it upsets our gut when we're training hard, but then we're always training hard, so we're never having a lot of fiber. I think that's a problem. And that's why I constantly preach, try not to do more than one marathon per year, more than once. We need to take those off seasons and do shorter distances. We need to take that recovery for our body, but also our mind, and also to add balance back into our life in the form of fiber, in the form of protein, in the form of sleep, in the form of social activities. Even looking at elite athletes, they're not doing this, more than twice a year. And if they are, they always get injured. They always end up with a health issue down the road. Always. I never say that always, and I'm saying always here. We look at ones who have done back-to-back races and it's part of their identity and they love it, and they always end up in a hole because it's just not meant to be that way all the time. So again, we can take a healthy habit and go over the edge with it. So when you start to hear things coming out, regarding this being only because of the sugary goos that runners are taking during their training and marathons because they're trying to meet sports nutrition recommendations, remember that we need context with those claims because that has not been established in the research. High sugar intake associated with colon cancer, yes, that has been established in the research, but not specifically in marathoners. We don't know why these findings are what they are essentially. And this doctor thinks it's essentially because of poor recovery and poor blood flow to the gut because of endurance running. So we also see that with other forms of high amounts of exercise like cycling, that colon cancer risk can be decreased in some other research. And they're taking carbohydrates in too, right? So benefit of the doubt here, there's not one right answer, is what I'm trying to say. Other theories as to why, maybe there's specifics on our microbiome that we're not sure about yet. Maybe there's, increased stress on the body. Oxidative stress is going to, contribute to cancer developing in a lot of different forms of cancer, not just colon cancer. So that's something too that I think we want to consider. And all of this to say, we don't know. We don't know why these findings are what they are. We have theories, okay? So how does this translate into where do you go from here? What do you do about this, knowing this information? One, don't freak out. Stress is not good for you, okay? Two, early screening. If you're really concerned about this, maybe you have a history of family colon cancer, you should be going to get screened early anyway. Those are the guidelines. But if you're also a runner and you're young, you're under 40 and you're like, I'm nervous about this. I have done 30 marathons. I've done an excessive amount of exercise in marathons for a long time. I have a history of, family with colon cancer or other forms of intestinal cancer, stomach cancer, those types of things. Yeah, I'm going to go get early screening because if we catch this early, it's not as big of a deal to treat. So that's huge. I think too, if you have GI issues, so if you are listening to this because you do have a history of GI issues and you are a runner and you're like, I have done more than 5 marathons or 2 ultra marathons, or I do have a history of colon cancer in my family, or I'm just worried about this, go get an early screening. Go express concern. Show this study specifically to your doctor because they probably haven't seen it yet because it's sports specific, and see what they say. Okay. Don't ignore GI symptoms. One of the things that this study does address, which I really appreciate because me and all my sports RD colleagues have been like screaming about this forever, is that we really shouldn't ignore GI symptoms. And we really, 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 really shouldn't just say, oh, like bleeding after your run, like, pooping blood, having a lot of GI issues and bloody stools is just runner's gut. It's just normal. Oh, no, 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 it's not. No, 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 no. That is a huge red flag, sirens going off. We want to look into that. Why is that happening? Because that is a sign of potential precancerous or cancerous issues in the colon. Like we want to look into that. Why is there blood? It could be something non-sinister at all, like hemorrhoids or anal fissures, internal bleeding, that's benign. And it could also be ulcers, it could be cancer, it could be polyps, it could be, menstrual issues if you're not sure where it's coming from. We want to look into this. This is not normal. And if you're a runner who's done again, many marathons, ultra marathons, and you're young and you're having these issues, you need to get this checked out. This is not normal. We don't just ignore this. And if you go to the doctor and they say, oh, runner's colitis, that's the diagnosis and we don't treat it. No, that's not an acceptable answer. You send me an email if you need extra support. Other things is to maybe look into stool testing. So again, just look into how I help clients, kind of what I talked about earlier. If you have GI issues or looking to get the root cause, reach out for support. It's in the show notes if you need the link. And this is something that we can look into. And if I see things on a stool test like elevated calprotectin, really high levels of zonulin or occult blood, I'm going to ask you to go get screened via a colonoscopy. I'm going to ask you to go to the GI doctor, and I'm going to keep supporting you to address whatever else I can address on the test too. So this screening process too can also begin with a stool test and doesn't necessarily have to be a colonoscopy. But if you do have family history, that's something that I would be even more cautious about now than I would be before, which I was already pretty cautious about that before since I have my own family history of cancer. So it's on my radar at all times. So at the end of the day, know that there's other research that basically says high amounts of exercise show no increased risk of colon cancer, show increased risk of, or I'm sorry, a decreased risk of colon cancer. And this study really contradicts that. And I think it's worth looking into more because that's a really big number, 1.2% to 15%. But know that you can do some stuff if this makes you nervous. You can screen early. You can do a stool test. You can come work with a sports dietitian to improve your GI symptoms. You can take a look at things if you're wanting to get screened early, or if you are a really high volume athlete who's done a lot of races and does have bleeding or does have GI issues and wants to understand why. I do think this is a good push in the right direction to maybe do it now, figure out why now, in case it does turn into something more serious down the road. I'm done talking now. That was a lot. You need to go have a snack, go take a walk. Check out the links in the show notes for the research, for support and working with me, and other ways that I can support you as well. And until next time, happy running and happy fueling.